Quality Watch is an educational production of IPRO. Opinions expressed reflect the views of the speakers only and not those of any company or agency. This podcast is intended for private, non-commercial use only. Please visit ipro.org to read our full disclaimer and terms and conditions.
Welcome to Quality Watch, the podcast focused on healthcare quality improvement. Quality Watch is a production of IPRO, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. I'm your host, Dr. Edison Machado, Senior Vice President of Strategy Solutions at IPRO. In today's episode, we'll talk about vaccine recommendations for this fall, the Medicare open enrollment period, and we'll take a deep dive into the efforts to end the AIDS epidemic in New York State. But first, a few quick headlines and updates from around the nation and here at IPRO. Healthcare worker burnout has been on the rise. A new study from the Centers for Disease Control and Prevention shows that feelings of burnout are less common among workers who trust management and had help from their supervisors. In this study, the percentage of workers who reported feeling burned out very often increased from 11.6% in 2018 up to 19% in 2022, and the percentage of health workers who reported being very likely to look for a new job increased from 11.1% to 16.5% during that same period. We are recording this episode as the annual Medicare open enrollment period gets underway. Beneficiaries enrolled in traditional Medicare or Medicare Advantage programs have from October 15th through December 7th to make changes to their plan selections. Among the changes for the enrollment period in 2024 are limits on out-of-pocket costs for prescription drugs. Experts say that Medicare enrollees can potentially save money by carefully examining their options and considering changing their selections during open enrollment. Last month on Quality Watch, we talked about school-based health centers here in New York State. On a related note, the Kaiser Family Foundation recently reported that 1/3 of the nation's schools do not have a school nurse, which poses a problem as more and more school-age children have chronic illnesses like diabetes and asthma, and as we face an unprecedented rise in mental health crisis amongst young people. To hear more about IPRO's work with school-based clinics, please visit the IPRO.org website to listen to our September 2023 episode of the Quality Watch podcast. Finally, with fall has come an increase in respiratory illness, including influenza, RSV, and COVID-19. This year, a new RSV vaccine has become available and is recommended for individuals 60 and over. In addition, consumers have the option to get an updated COVID-19 vaccine this fall. Both the mRNA formulations from Pfizer and Moderna, as well as a protein-based non-mRNA vaccine from Novavax, have been granted FDA emergency use authorization for those 12 and over. "42 years ago, a strange cluster of diseases began appearing in relatively young, otherwise healthy patients, many of which were gay men. A year later, the CDC labeled the phenomenon Acquired Immune Deficiency Syndrome, or AIDS. In the early years, there were no treatments for individuals with AIDS, and clinicians could do little to ease their suffering or prevent their premature deaths. However, over the past 4 decades, that has changed quite a bit. We now have tools to prevent the spread of AIDS, as well as to reduce the viral load in patients who are affected. Since 1991, IPRO has worked with the State of New York Department of Health AIDS Institute to develop and implement review processes that inform the department on the quality of clinical care provided to individuals with HIV across a broad range of clinical and community care settings. The goal is to decrease new HIV infections in New York State to less than 750 per year. On today's episode of Quality Watch, I welcome 2 of my IPRO colleagues who lead the work with the State of New York on this project. Wendy Ferguson is Assistant Vice President of the State Healthcare Assessment Department, as well as the AIMS program here at IPRO. She's joined by Clifford Prasad, Director of Ames Review here at IPRO. Wendy and Clifford, welcome to Quality Watch.
Thank you for having us.
Thanks, Eddie. It's a pleasure to be here today to discuss these projects.
Great. Well, let's start at the beginning. So, Wendy and Clifford, how long has IPRO been engaged in the Ames work with the New York State Department of Health?
So we started this work in the early 90s, not long after the New York State Department of Health implemented their AIDS Institute to do research and to look at the quality of care with the people impacted by the AIDS epidemic.
And for anyone that's wondering, AIMS is an acronym for AIDS Intervention and Management System.
Great. Well, what are some of the activities that IPRO performs in support of this work?
So we're looking primarily at the quality of care provided to individuals who are impacted by HIV disease. We're looking primarily at chart review and providing data to the New York State Department of Health AIDS Institute so that they can manage the different programs that are provided to people living with the disease or people living with family members who are impacted.
Thanks, Wendy. That sounds like some very important work. So I know as part of it, the phrases PrEP and PEP often are associated with it. Could you let our audience know what those acronyms stand for?
So I'll speak a little bit about the PrEP and PEP. So PrEP is a pre-exposure prophylaxis and PEP is post-exposure prophylaxis. They're both antiretroviral medications used to prevent HIV transmission.
Thank you, Clifford. And who should be on PrEP or PEP, and what are the different types, I guess, of PrEP and PEP?
So let's talk a little bit about PrEP first. So currently there are two types of PrEP, oral and injectable. Oral is a daily pill and the injectable is taken once a month. So individuals such as injectable drug users or people who have unprotected sex with HIV partners or have multiple partners or have recently been diagnosed with a lot of STDs should be on PrEP. For PEP, it should be more for people who are suspected to have exposure through IV drug use or sexual activity. If they suspect any transmissions, they should take the medication after that activity.
Thank you, Clifford. Now, what's the impact of PrEP or I guess PEP on HIV transmission itself?
So recent studies have shown that there has been a significant decrease in transmission rate of about greater than 90% when taken appropriately, because some patients or some clients, they tend to not take it regularly and miss doses. Those who see a lesser percentage of transmission, so about 85.
Thanks, Clifford. That's fairly significant in the upper 80s with regards to reduction of transmission. I guess can either you or Wendy talk a little bit about some of the other outcomes related to the work? For example, the rates of maternal transmission of HIV?
So that's been one of our most important and long-standing projects. And what we do there is we track all mothers who have been exposed to HIV throughout New York State. And it's a part of a New York State law, which is mandated that all infants are tested for HIV. So based on that data, we look at those cases and we report back to the state the mother-to-child HIV transmission. And we've been doing this since 1997, every year since then. So we've looked at hundreds and thousands of cases. So we've gone from, very high numbers in the hundreds in the early days down to very low numbers right now. And at the moment, it's statistically 0% of transmission that's occurring, which is a great success story and a really great reflection of what monitoring can do and how consistent evaluation of the program.
So as Wendy mentioned, the decrease in rate. So in 1997, it was high as 11%, and most recently, almost at 0%, which is very statistically significant.
Well, thank you both. I mean, statistically significant. I mean, I think it's just very meaningful, obviously, to the state of New York residents, right? That such a tremendous improvement could be achieved. I'm going to shift gears a little bit and just maybe ask you a little bit of how do the social determinants of health that are obviously in the news affect the quality of HIV care these days?
So this has been an important introduction to the program with adding data points. And things that we're looking at are socioeconomic status, including transportation, housing, access to services, and not only health services, access to housing, food, nutrition, transport. And we're also looking at things like environmental stresses that can have a huge impact on the health of people, whether they live in an area that is unsafe, whether their housing is clean, safe, whether they are living in a food desert, for instance, so they do not have access to good quality nutrition, and whether they have access to preventative measures, such as regular interactions with their providers and access to things like PrEP that we've spoken about.
Thank you, Wendy. I know as part of the delivery of care to these patients, the state really counts on the health plans playing a role in really trying to help achieve some of these outcomes. From your experience, how successful have health plans been at helping support the treatment of patients with HIV and with helping with the reduction of viral load?
So that was about 20 years ago. That was a very significant model that was introduced, establishing special needs plans, which we call SNPs, just for patients with HIV and their families. And it means that people have a coordinated model of care. They have access to mental health services, substance use services that they may need, medication services, clinical services. They track through hospitalizations and through different parts of their progress. So it's been very successful in that the SNP plans really do a good job of monitoring the care, tracking people, and really making sure that they have access to all the services that they need. And I'd just add there that this was a challenge during the pandemic also, trying to find people, make sure that they were still connected, and the staff did a good job during that time of maintaining, telecommunication with people and tracking that they were still receiving their medications.
Well, that's good information for the audience to hear. I imagine that many of these individuals with HIV also can oftentimes have other comorbid conditions. And what you hear quite often is hepatitis, obviously being a comorbid condition. Has IPRO been involved in working to help address or support the treatment of individuals with HIV and hepatitis in any way?
So the means of transmission of HIV and hepatitis C overlap considerably. So many individuals impacted by HIV are also impacted by hepatitis C and other sexually transmitted as well. But hepatitis C has undergone a lot of treatment advances, and the treatments are far less toxic than before. So those treatments available have been offered to people with HIV who also tested positive for hepatitis C. And they were also able to implement education programs also to help people prevent hepatitis C and to find out when the best time for them to receive treatment and the types of treatment if they were impacted. This has been particularly significant in the corrections institutions. And people in the corrections institutions, some of the inmates there, have been offered hepatitis C treatments. And fortunately and unfortunately, they are incarcerated for a significant length of time. They're able to receive the full course of treatment without interruption. And there's been some success there with that population in helping them cure their hepatitis C before their release and get back on track.
So here in the AIMS department, we do a yearly review of the DOCS review, which is the Department of Corrections and Community Supervision Department. And we look at adherence to the New York State clinical guidelines to detect, treat, and prevent HIV and hepatitis transmission in the inmate population or the incarcerated population.
Thank you, Clifford and Wendy, for that important information. Now, as we started, we mentioned that the goal is to really reduce transmission to fewer than 750 cases per year. So my question is, has the state been able to achieve that goal with regards to reduction in transmission?
So the state was really on track to achieve that goal. It was a 5-year goal. However, the pandemic came right towards the end of that goal. So they didn't quite get there at that point, although, all steps were being taken to do that. There were some setbacks at that point just because people were not seeing their doctors as often as they were before. And also people were impacted by COVID themselves. So the state is definitely back on track with that goal, and it's very achievable, and we expect to see that goal.
Like Wendy mentioned, up until the pandemic, there was a decrease to meet that goal. But stats have shown that in 2021, there was a significant increase in new diagnoses of HIV. So hopefully we get back on track to decrease the amount of new diagnoses.
Well, it's a shame that the COVID pandemic had such a detrimental impact on what sounds like good progress towards the goal. But as you both mentioned, hopefully, as we look forward, we can get back on track. Speaking of which, as you look at the work moving forward post-pandemic, what does the state have in mind with regards to helping to support this population?
So the state is continuing to work with us and asking us to continue to monitor folks with HIV, making sure they're taking their medications and that they are suppressed. Their viral load levels are suppressed, which means they're not transmitting the disease and they're not feeling the disease impacts. So we continue to do that, and we continue to provide that data back to the state.
Well, thank you both for sharing such important information with our audience on this vulnerable population. Where can our listeners learn more about the great work that you and your staff are doing with the Department of Health in this area?
So we've worked with the Department of Health and we've produced some publications that are available, particularly with patients who had COVID and HIV, which has been an ongoing problem. Also, the AIDS Institute has very significant resources that include some of our data and very useful programs and very useful information on accessing PrEP and services that people may be interested in. Also to note, we're continuing to work with the AIDS Institute on other infectious diseases as they possibly emerge. And some of those things are not only hepatitis C and COVID, but things like monkeypox, which is now Mpox, and when Ebola was an issue some time ago. And also the increase in some of the sexually transmitted diseases such as chlamydia, gonorrhea. So the best place and the best resource is really the AIDS Institute website.
With regards to this work, Clifford and Wendy, who are the provider types and the care settings that you find yourself working with under this work?
Primarily, we're looking to work with in the community with the primary care providers, infectious disease specialists, but we also look at patients who are coming into the inpatient setting to see whether they're being offered HIV testing, which is a recommendation, to see whether they're being tested in the emergency room if they have symptoms that may lead to a suggestion of HIV. If somebody's been, for instance, sexually assaulted or is a drug user. We're also looking into some of the mental health providers to see whether they are also working with. We find that a lot of the population who has HIV is also impacted by serious mental illness and substance use as well, which can severely impact their care.
Well said, Wendy. And some of the work we do here reflect directly the mental health and HIV and SDOH, the social determinants of health and HIV, and the substance use and HIV.
Wendy and Clifford, thank you once again. Links to more information about this work can also be found at our IPRO website, that is IPRO.org, as well as in the Quality Watch show notes. It's time for us to crunch some numbers in our Data Watch portion of the program. The American Cancer Society's annual Great American Smokeout is coming up on November 16th. Inspired by that event, here are a few interesting statistics. Tobacco use is the leading cause of preventable disease and death in the U.S. Nearly 70% of those who smoke wish to quit, yet only half receive guidance from healthcare professionals, while just 1 in 10 successfully quit. Fewer than 1/3 who attempt to quit use cessation treatments. Inspired by the Great American Smokeout, the IPRO Quality Innovation Network Quality Improvement Organization, or QINQIO, has launched a campaign to encourage providers and community-based organizations to talk to their patients and constituents about quitting. The campaign, #AskAboutQuitting, provides free resources, social media graphics and posts, a sample press release and newsletter, and more that can be customized and branded by any healthcare provider or organization. For more information, please visit qi.ipro.org. That's it for this episode of Quality Watch. I'm Dr. Edison Machado, and on behalf of IPRO, thank you for listening. To learn more, visit our website at ipro.org. That's IPRO.org. If you enjoyed this podcast, please leave us a comment and subscribe wherever you listen to podcasts. We'll be back next month with more. Until then, we'll be working on better healthcare realized.